Oh, happy Thursday, everybody. Hopefully you're all having
Happy
a good week.
Thursday to you.
Thank you. It's been a good week so far.
Good.
Yeah, one thing I wanted to try today is something that I do with my staff team at Latino Community Association is just ask everybody to put in the chat if it's voluntary, totally voluntary, but how you're doing on a scale of 1 to 10, 10 being amazing, and 1 being really lousy. So just the number. Oops, I gotta.
Well, this is Chris Woodard, and she's on the phone, and she's going to say a 9, so she's doing pretty good.
Thank you, Chris. That is pretty good. Nice.
Is this work-wise, personal-wise, busy-wise?
You can answer it any way you'd like. Just you as a person, which
Okay.
incorporates all of those things. And somebody's asking, Mandy, the question was just, are you on, where's Mandy? Yeah, you're with us on internet, Zoom. To put in the chat, if you care to, how you're doing on a scale of 1 to 10, how you're feeling. 10 being amazing and 1 being pretty lousy, 5 in the middle. All right. Oh, Kelsey, you're quick. Great. So we see a full range, pretty good range, but it's all above 5, so that's a good sign. All right, thanks. That's just one way to check in, see how folks are doing. Let's go ahead and open up for public comment.
Okay, I have a public comment. This is Chris Woodard, and on Tuesday, I went to Bi-Mart and discovered 20 tents and cars, part of the homeless community next to the shelter, and realized that it has expanded to where it's both sides of the street. And I'm thinking, okay, I'm not sure how to solve that issue, but it's a new community. I mean, the community has gotten larger.
Where'd you say that is?
That is on 2nd Street in the Bi-Mart parking lot.
And you're talking about Bend?
Yes.
Yeah, it's about a block west of Bi-Mart. So yeah, it's basically the entire street.
Yeah, it's
Both
called
sides.
Emerson.
Yeah, it's both sides of the street. It's actually all 4 sides of the street. And the shelter's on, I guess, the left side of Bi-Mart if you're facing it. So it's 1 block from 3rd Street.
Yeah, the shelter is inside the Bi-Mart parking lot off to the side.
Right, but it's, I mean, I guess it's full, and then, you know, the tents and the vehicles and I mean, I was in shock because I'm thinking, oh my gosh, I mean, this is like a community in this parking lot, and there's just 2 stores there, and they almost need to make it something to where it's, you know, a shelter community without the stores. But the stores, I don't know, I just was like, I was a little overwhelmed with seeing this, going, wow, this is in Bend?
It really is.
The shelter is closed.
Oh, really?
Oh, is that what it is? Oh, I didn't know that.
Oh, so it's
The rumor
only
is it'll be
winter?
open in about a month or so, but right now it's closed. It's been closed for over a month.
Oh, wow, I didn't know that. I thought it was.
That's why I made the comment, because I'm thinking, what's up with this?
So that
and
answers
the
our question.
police are allowing that right now because of COVID. There's even a bigger community on the north
Over there
end
by the
of town
Shepherd
on a
House.
street called Hunnell.
Yeah, by the Shepherd's house. There's like 2 big communities of homeless.
Well, this one is behind Lowe's, north end of town.
Oh, so then the ones over there by the Shepherd's house, there's like on, is it
Off
Revere?
the highway.
Yeah, off the
Division,
highway on one
yeah.
side and then on the other side. So it's like right behind Carl's Jr.'s kind of, and then one right before you hit Bend Treatment Center.
Yeah, but the biggest one is probably behind Lowe's on a street called Hunnell.
Oh, wow. That's sad.
Yeah, that's gotten huge. It is sad. Well, thanks, Chris, for bringing that to our attention.
Okay. Sure.
Anybody else? Public comment?
I would love to provide a public comment, and I think it's sort of in line with what's being discussed now. So Neighbor Impact, Thrive Central Oregon, and it's called Klamath Lake Communities Action Services, all have emergency COVID-19 rental assistance available. Neighbor Impact is really encouraging people to, if they've fallen behind on their rent or they need assistance, please don't wait until June to apply, because we're expecting that could be when the eviction freeze is lifted. So if you or anybody in your, community needs help, please apply. You can contact them by phone or you can go on their website. I'm happy to drop that link in the chat right now. And then Thrive Central Oregon is also offering rental assistance. They also can help with utility deposits, application fees. And they also have mortgage assistance available, but only for our community members that live within Redmond city limits. I will also drop a link to that in the chat. So that's for Thrive Central Oregon. And Healthy Klamath is the webpage that is sort of the link to the housing assistance for our friends in our Northern Klamath region. And I just put that in the chat as well. And it looks like there's an informational video on that webpage about the Oregon Rental Assistance Program. So yeah, please, there's a lot of money right now available for rental assistance. And I know that Buffy is on the call as well. I know that there's a program specific to the Confederated Tribes of Warm Springs as well. I wonder if she's available to speak a little bit.
Buffy with us?
She might have just stepped away. But if you would like any information about that program, please reach out and I'm happy to connect you. I'll put my email in the chat.
Thanks, Kristen. Anybody else? Public comment?
I just wanted to acknowledge Kelsey Seymour for helping put together the videos to dispel the myth about COVID-19 vaccine causing infertility. Her and Central Oregon Health Council helping the Deschutes County Public Health Advisory Board get this message out is, I think, going to really make an impact. So I just want to put that out there, that there's some great videos.
Nice. Thanks, Tom. And Kelsey. All right. Well, thanks to those of you who provided comments. I'm going to step back. I skipped over having us introduce ourselves. So Kelsey, could you help us with that, please?
I'm so sorry, I was typing in the chat. What was that?
Could you help us handle roll call?
Oh, absolutely.
Introductions?
Yeah. Brad, I'll start with you and then Larry.
Okay, Brad Porterfield, Consumer Representative, CAC Chair, Health Council Board Member.
Larry Kogosik, Consumer Representative and Vice Chair.
Maida and then Linda. Is Maida still on the call with us?
Yep. Just getting her mute handled.
I'm trying to multitask here. What was the question? I'm sorry.
Can you introduce yourself?
Oh, yes. Maida Benitez, Consumer Representative.
Linda Johnson, Health Council Community Representative.
Tom and then Regina.
Tom Kuhn, Deschutes County Public Health.
Regina Sanchez, Crook County Public Health.
Elizabeth, and then Mandy.
Elizabeth Schmidt, I'm about choking, consumer representative. Thank you.
Mandy Seeley, consumer rep.
Awesome. And then Ken, and then Chris.
Ken Wilhelm with United Way. I'm a community representative.
Chris Woodard, community representative.
We'll go through the Health Council staff, Donna, and then Michaela.
Hi, everybody. Donna Mills, Executive Director, Central Oregon Health Council. My pronouns are she and hers.
Gwen and Renee.
Hey.
Oh, sorry.
Hello, everyone. No worries. Michaela Arsenault with the Central Oregon Health Council, and my pronouns are she, her, and hers.
Same as previous, but Gwen Jones.
Hi, this is Renee Marcus Hoden. I am with Community Catalyst, a national nonprofit healthcare advocacy organization who's been doing some work with both the OHA as well as with folks at the Health Council.
Thank you so much. I am so sorry. I did not realize there were 2 different Renees on the call, so I'll try to remember to use last names. So it's really nice to meet you. Renee Worth, why don't you go next?
Hi everyone, Renee Worth. I'm always happy to meet another Renee, especially one that has the same spelling. So nice to meet you, Renee. I'm a project manager with Central Oregon Health Council, and my pronouns are she, her, and hers.
Awesome. Rebecca?
Hi everyone, I'm Rebecca Berry. I'm the Grants and Metrics Manager here at the Central Oregon Health Council, she, her, and hers.
And I'm Kelsey Seymour. I am the Administrative Assistant and Media Coordinator. My pronouns are she, her, and hers. Guests with us today, Tanya and then Buffy.
Hello?
Yeah.
Sorry, I'm like double muted. Hi everyone, Tanya Curiel with the Oregon Health Authority's Community Partner Outreach Program.
Buffy, you're on mute. Oh, there you go.
Buffy Hurtado, enrolled member of the Confederated Tribes of Warm Springs, Tribal Liaison for Pacific Source.
Welcome. Next we have Leslie and then Kristen.
Hi, Leslie Neugebauer, Senior Director of Medicaid Governance at Pacific Source.
And Kristen Tobias, Community Health Coordinator for Pacific Source, and my pronouns are she, her, and hers.
Okay, did I miss anyone? Oh, Rebecca Donnell, you just joined us.
Yes, hi. There's 2 Rebeccas as well. But I knew that you were going through the Health Council folks. Hi, I'm Rebecca Donnell. I'm an innovator agent with the Oregon Health Authority, and pleasure to be here today.
Awesome. I think that's everybody. Thank you all.
Donna, did you introduce yourself? Did I miss you? Okay. I must have spaced out for a second.
You're just so used to me, Brad, that it's fine.
All right. Next order of business is approving our meeting minutes. Hopefully everybody had a chance to read through those. There were a few actions highlighted, and my understanding is we've taken care of all of those actions, but if we want to go through those real quick, we could do that. Thank you, whoever's scrolling, presenting. So one was me sharing the written update from the board meeting, my conversation with the Health Council board about their expectations of the CAC and Community Advisory Council. And we did that, yes. Did everybody get those notes? Yeah, okay. Next. Okay, we'll add the continuation discussion, and that is on our agenda to continue discussing our, what are we calling it again? Community health projects process. And Michaela will add the continuing, I already did that. Michaela will add flexible services to the next CAC agenda. So we got the slides in our packets, and We do have the flex funds on our agenda, but we're not going to have we're not able to have a full discussion about those today due to Pacific Source folks who are really educated and informed on that being able to be with us. And we also have a need to go over the share initiative. So that's going to take up more time today in flex funds. Just a little mention, I think, is what I'm understanding. So, but we will definitely move that to June to have a full conversation about that. And I also understand that members of the CAC have reached out, have had conversations with Pacific Source folks about those flexible funds offline. So that's fantastic. I don't know if there's anything anybody wants to share about that. We have maybe just a minute. If anybody has reached out about flex funds and you learned something, had an aha moment, or feel like you want to share something, you could do that now for 1 or 2 minutes, if you'd like. Nope. Okay, let's move on. Is there anybody? I think that's it for all of our actions.
Brad,
Yes.
I'll move approval of the minutes.
Thanks, Ken. Is there a second?
Second.
All right. Thanks, Larry. All those in favor of approving the minutes, please indicate yes. You approve.
Yes.
Chris, yes. Elizabeth, you're on the phone.
Yes.
Okay.
Linda's yes.
Everybody else? You're putting it in the chat. That's fine as well. Okay. Any no's? Anybody who's just does not want to approve the minutes? All right. All right. We're good. Good to move on. Yes. All right. So Rebecca Donnell or Donnell, would you like to start with your Oregon Health Authority updates?
Sure, thank you.
Yeah, thank you.
Yeah, and I'll just share my pronouns are she, her, and hers. I forgot to do that before. Thanks for having me today. Each month, it's my goal to send an email update to the Health Council, which has a long list of information, of course, the most updated information I can gather around COVID-19, COVID-19 technical assistance, and then any learning and engagement opportunities by the Transformation Center or other entities within Oregon Health Authority or even in the community, as well as community resources that are available, many of them, again, related to COVID, but others related to OHA benefits and those types of things. And so I'm just going to go through a couple of highlights. I'm not going to go through the whole document. It's there for your reference. It has links to information as well as key contacts for folks to follow up with. But I'll go through a couple of things each month that I think are new and maybe topically relevant to the work you're doing. One thing I'll point out around COVID-19 is I included a link to the state dashboard for vaccination information, and that information is nicely summarized by county. So if you're looking for information, there's a link to that that's updated frequently and easily accessed. It sounds like Kelsey has put together some videos with local community stakeholders to answer questions around vaccine safety. But if you're looking for some other resources, there's a campaign called Safe and Strong, which is also a video campaign put out by the Oregon Health Authority. There are a couple of 60-second videos called Vaccine Answers that address questions related to the safety and other frequently asked questions around COVID-19 vaccine. They're available in English and Spanish, and they're being developed in other languages as well. I included the link to that so folks can look at those and see if they might work for your community. There's virtual learning collaboratives around COVID-19 vaccine that have been going since April 16th. The next one is May 28th from noon to 1. And then there's also one June 11th and June 25th. So they're really geared towards local clinics who are looking to increase their capacity to offer COVID-19 vaccine. Again, sort of clinic level information about questions that folks are having about logistics, operational workflows, those types of things, allocations. So if you know of clinics that would be interested, that's a resource. The REAL-D data collection efforts from OHA, we've gotten quite a bit of questions from other health councils and Pacific Source in other areas. And so Belle Shepherd, who is an innovator agent who's on rotation with government relations and is working on the REAL-D project, is holding office hours to answer questions. And for those who maybe aren't as familiar with REAL-D, it stands for Race, Ethnicity, Language, and Disability Data Collection, and the reporting requirements around that. So those are happening in May on May 21st, in June on June 24th. So people can tune in. Again, it's a technical assistance resource to have folks that have been hearing questions from members or from staff, or are concerned about the logistics of data collection, and to provide technical assistance there. Also, there's payment reform focus groups that are happening, and those will be happening in May. Information there. And then the other note, some of the other information is ongoing technical assistance and learning and engagement opportunities that I've shared before. I did want to note this one community resource that was shared this week. Emergency broadband benefit, internet service for Medicaid members. Oregon Health Plan members can get a $50 monthly discount on internet service during the pandemic from a new federal program. A household can get help paying for internet if anyone in the household qualifies. If an OHP member is already enrolled in Oregon's Lifeline program, they can get this new benefit too. And there's all the information for how to reach out and contact folks about eligibility. So if community members are interested in that, that's a resource. Those are my updates. There's a lot more information in the email. So feel free to look through it. If you have any questions, you can always contact me, but there's also good contact information for folks that are providing the technical assistance or learning session, et cetera.
Thanks, Rebecca. Does anybody have any questions or comments related to Rebecca's update?
This is Linda. I have just a recommendation for the rest of the CAC committee. For those of you who haven't been to the annual OHA Learning Conference, the annual CAC convention, this year it's virtual. And I know that Michaela sent out information and a link to it earlier. And I wanted just to share the agenda, because a lot of what Rebecca just shared with us is on the agenda as well, especially the second day. Michaela, if you could move it up, well, you can see the keynote presentation is about social determinants of health. And then on the second page on June 9th, there's a panel on COVID-19 and CACs. So you get to hear the experience that other CACs are having in their regions and appreciate how different we are and what we can learn from each other. And then a discussion of community health improvement plan projects. And then at the end of the day, I've been asked to be part of a panel for CAC members who are also on the governing board. And what OHA has done a survey of CAC members who are also on the governing boards. And so we'll share some of that and answer some questions and common experience. So I think it will be meaningful. And I just encourage, especially for the newer members of CAC, it's a great way to update yourself on some really specific information about being a CAC member and what are some of the skills you might want to think about or knowledge deficits that we all have that you can improve on. So, thank you.
Linda, I have a question.
Yes.
Will this be recorded and available afterwards? Because I have a prior commitment, but I'd really like to participate.
I don't know. Do you know, Rebecca?
I don't, but I can follow up right now. I can actually follow up with Tom Cogswell and put the answer in the chat.
Okay, that'd be great. Thank you.
Nice. All right. And how many are there folks that do plan to attend? I plan to attend as much as I can. Linda, anybody else? Going to be able to do that? No?
But and I will be there.
Okay, some of the staff. All right, well, good. It's a good opportunity. And hopefully it will be, I would guess it will be recorded, but Rebecca will let us know. So let's move on with Michaela and Gwen, Community Health Projects, Process Development. Continue our discussion.
All right, let me move my screen around just a little bit. Okay, so today I was hoping to do just a really quick recap on community health projects, what it is, and then finish our discussion around setting an award limit if you would like to around these projects, talk about the timeline for funding and making final decisions, look at the draft requests for letters of interest that I put in the meeting packet, as well as the questions that we're asking the applicants to fill out. Sound good? Okay. So just a refresher, community health projects, also called in CCO lingo, community benefit initiative. So they're one and the same, but today we're just going to be saying community health projects. So they're community level projects focused on improving population health and healthcare quality. They are meant to address social determinants of health and equity, and they have to align with our regional health improvement plan. And so what did they do? Like I said, address social determinants of health, but they improve health outcomes, reduce health disparities, promote the efficient use of resources. They have to align with the RIP, promote and increase wellness and health activities, and improve overall community well-being. All right, so just kind of a refresher of what we talked about last time. So going to the next slide. So last month, we said the budget was $370,000 for 2021 community health projects. We found out there was some funds left over from last year. And this was just how the monthly rates panned out at the end of the year. It wasn't because we didn't allocate enough funds. So the new total for 2021 is $431,681.98. And like always, they have to be spent by the end of that year. So these funds have to be spent by December 31st, 2021. Next slide. Okay, so last month we talked about whether or not the CAC wanted to narrow the focus of the community health projects or the projects that you'll be looking at funding for this year. And the result from our conversation last month is that you wanted to keep it broad, focused on social determinants of health and health equity, but really looking at and prioritizing projects that serve rural communities, as well as serving populations that are severely impacted by system barriers to health. Next slide. Last month, we also talked about looking at a different review process. There were some comments that our last process, which we received 42 full length applications, it was a heavy lift for CAC members to review, even though we split the CAC members into smaller review groups. Another con to that was that not every CAC member got to read each proposal and score each proposal before making that first round selections towards funding. So next slide. And so last month, instead of doing a request for proposal, so this slide shows on the left-hand side, kind of comparing the request for proposal versus putting out or requesting letters of interest. So last year on the left-hand side, you put out a request for proposal and you ask the community to fill out these long applications giving very detailed information about their project. And it was more work on the applicant, especially for those who didn't get funded. And it was a lot more work for the CAC to review. So last month, you decided to go with putting out a letter of interest into the community. And so this is to gather kind of high level information about the projects, and then making like a second round or selecting certain projects that you wanted to learn more about and were interested in funding. And then those projects would then fill out the full application that you would then review and decide on funding. So let's pause there. Questions on kind of the summary of last month?
Michaela, just a brief question. When we talked, I wasn't at the meeting last month, and when they talked about focusing on a rural area, are they considering the city of Bend as a rural area? Or so would that be exclusionary of Bend-based projects, or is Bend included in the definition of rural area?
I'm going to put that question out to the group, asking about Bend, but then also Redmond as well. What do folks think?
I think we said that Bend projects would be included, but that we would give special consideration to rural proposals.
And when so I'll show a timeline here in just a little bit, or it'll show that next month we'll be looking at a scorecard, and we can add in kind of a line within that scoring system to give or to kind of prioritize those applications.
Or maybe bonus points.
Yeah.
For city project.
Additional thoughts around that?
Yeah, I would just reiterate what Larry said. We're not excluding anybody, but just kind of recognizing that most of the resources go to Bend and even Redmond, but that we don't want to forget other communities across our region.
Okay. More questions about last month? Rebecca says the Oregon Office of Rural Health does not consider Bend or Redmond as rural, if that's helpful to the group. Okay, let's move on to the next slide. Okay, so this is where we ended our conversation last month around setting an award range for these projects. Last year, in 2020, you set the award range for projects or funding projects between $5,000 and $50,000. This year, you have $431,000, just a little over that amount. So I want to get your thoughts on what you'd like to see this year. In conversation last month, folks talked about allowing for kind of a higher funding cap, so extending that $50,000 to allow for multi-year projects. A couple of the suggestions were a range between $20,000 and $80,000, and then there was one suggestion of between $5,000 and $75,000.
Did the group last month, or have we as a committee talked about whether we want to encourage larger projects that would involve and require collaboration between 2 or more agencies coming in together on a more significant grant, or is that not one of the areas we want to think about?
So that didn't come up last month. But does any of the CAC members like to respond to that?
I'm looking at Ken. Ken, do you have any thoughts about that? Just because you lead a granting organization?
Sorry, for trouble with the mute button. I think, and I think Mandy made a comment in the chat I support that concept. I certainly wouldn't want to make it mandatory and try and push people into it. But just as we talked about, maybe giving extra consideration for projects in rural areas, I think it would be justifiable to provide additional weighting towards those places where there was a collaboration around a larger project. If the question was, would a collaborative project allow for going beyond the 50,000 maximum? I certainly would be open to that kind of thing. A larger project would justify a larger award.
Thank you, Ken. And along those same lines, when we were, as it relates to the type of, or the level of funding, my sense is that if the bottom level of funding was 20,000 or more, that might require then, or move towards requiring that multiple agencies do it, and it would exclude smaller projects. And I'm okay with the 5,000 if we want to be sure that we do allow for both smaller projects and larger collaborative projects.
I guess maybe we can break up the conversation to talk about the lower end. What are some, what are some pros about keeping it at 5,000?
I'll jump in since I brought this up last time. And Linda, I agree with you. Yeah, we don't want to exclude smaller projects. I don't see any reason to do that. I think the only advantage I can see is that it might limit the number of proposals, maybe, that would get submitted, but not necessarily. So I think there's more advantage to being inclusive and allowing that smaller projects need less money. Yeah.
What are some other pros and cons?
What are some what?
Some other pros and cons about keeping it at 5,000. Looking at folks who maybe haven't provided an opinion yet.
Well, I just think that the quality of the proposals, the quality of the projects are going to speak for themselves and aren't necessarily contingent on their size. So you could do something really imaginative and sort of wonderful at 5,000 or at 50,000. And, you know, restricting things on its size without considering the quality of the project or proposal itself, I don't know, that's kind of limiting, I think.
Are there any thoughts around moving the 5,000 floor up, not having it as 5,000, but maybe something, a larger amount?
I think my personal belief and opinion is that if we eliminate the smaller projects, that it might discourage innovation and new entrants into the market with new ideas and new organization that's been formed around a specific purpose that meets our needs, for example.
Okay, so let me take a pulse on keeping, I guess, the bottom of the award range to 5,000. If folks could write in the chat, like a yes for keeping it at 5,000 or a no for bumping it up higher. And then Elizabeth and Chris, you're welcome to share your thoughts on that. I know you're on the phone.
I say keeping it. This is Chris.
Okay, Elizabeth? All right, Mandy said, I'd actually make it lower, but I support the group's decision. Okay.
I mean, I guess Mandy raises a reasonable suggestion. Why even have a floor? Why not just have
I can speak to why. Here in Sisters, I can think of 3 community grant opportunities that are capped at 2,500. So, you know, that's just for Sisters, and I don't know what the other communities are like, but for those folks who need something in between like 2,500 and 5,000, that limits where they can go for funding. So that's the only reason that I say that.
Yeah, what do folks think about just having an upper end maximum?
I guess my concern initially would be that we would, if we were to eliminate a lower end, that we might get more grants, which would be an impact on all of us reviewing them and staffing, just because of the volume increase. But the other piece that rings out to me, and I don't see it in the letter of interest letter, talks about how the council, the Health Council, has always made sustainability a priority. So with the request for funds, except for the COVID funds, which were sort of term limited, that is a part of the application. They speak to when the funding runs out from us, how do we know what has the organization done to make that project sustainable? And if we're asking for, or we're granting less than $5,000, it seems like would be a stretch for anyone to show how sustainability of that idea, if it's successful, would be possible.
One thing that I do want to throw out there, which I don't want to discourage dropping below the 5,000, but the process, or at least the application for the applicants to fill out with all the requirements that we have to have and they have to meet for OHA, it is a time commitment to kind of filling out the applications and reporting.
So we are running up against time, and we're actually over time a little bit, but for this agenda item, could we maybe, so make a suggestion, could we put the range, we can incorporate what Mandy suggested, go down to 2,500. Does anybody object to 2,500 as the lower limit?
I guess
No
I'm
objection.
so if a project is 2,500 and you know it's exactly 2,500, they're not, we can't put it up to 3,000, like a 3,000 cap, and it be $500 over. I guess I'm not understanding.
2,500 would be the smallest amount anybody could request.
Okay, so if their project costs 2,500 and we have it up at 3,000, they wouldn't be able to apply.
Correct.
Oh, okay. That's where I was. Thank you.
Michaela, is this something that could be answered after the meeting with a poll of some sort of?
Yeah, so one suggestion, I can send out a survey to the CAC members and then bring those results to the June meeting for you to approve or to look at and then make a decision on. Would that work for folks?
That sounds good. Does that not work for anybody?
And then what is our deadline to get the feedback on the letter of interest topics?
So, yeah, I do. Yeah, thanks, Gwen. So this is the draft timeline that I wanted to show you. So I was hoping today we'd finalize the letter of interest, so the request that would go out into the community. I can send that out again for feedback. There's a couple small edits I need to make first on that I wanted to show you today. That can wait. Next month, we'll finalize the award range and then also work on that scorecard. Hoping to get the letter of interest, release it out into the community by June 21st. And that would give applicants about 6 weeks to complete it and go through our grant management software platform. CAC does not have a July meeting. And so before your August meeting, you'd score those. Remember, it's just high level of the project. We'd bring those scores back to you, and then the CAC would make a decision on which letters of interest or applicants you would like to invite to fill out the full application. Those that you invited to fill out the full application would need to submit it by September 30th. And then at your October meeting is when you'd make final funding decisions.
So are you wanting feedback now or online or offline for changes to the letter of intent? Not like
so I'll send out an email and ask for some feedback between now and next meeting. And then we can take a look at that as a group next month.
Thanks.
Is there anything else, Michaela? We're pretty much out of time for this item.
We are out of time, so we'll have to do a little work in between meetings. We'll talk more next month.
Okay. All right. Thanks everybody for your input, and please do provide feedback offline, either through email or phone. We want your input. Share initiative with Kristen Tobias. You're up, Kristen.
All right, I think Michaela was going to share. Sorry.
A new share.
Sorry about that.
I can get it, Michaela, if you want.
And I also just wanted to mention again, I apologize for the change in the agenda at the last minute with flex funds. But if you do have any questions or are maybe wanting to apply, please reach out. I put my email in the chat and phone number. I can put it there again. But we will plan to have a member of our member support team come in June to answer all of your questions. Okay, so share initiative. Next slide, please. So what is the SHARE initiative? This acronym stands for Supporting Health for All Through Reinvestment. This requires the CCOs to spend a part of their profits in the communities to address health and the social determinants of health and equity. So we are pretty fortunate to have some revenue from 2020. So we're going to be able to put some of that back into the community. Next slide, please. So as you can see, the spending needs to fit within at least one of the 4 social determinants of health and equity areas. This is a funding stream coming from the Oregon Health Authority, or permission from the Oregon Health Authority, I suppose, where CCOs can spend the money directly on supportive housing. And so that is what we're going to do. And it sort of fits in really nicely with our public comment earlier. Next slide, please. So spending has to address housing, and it has to go to one of our partners working in social determinants of health and equity. Spending needs to fit within our regional health improvement plan, and thankfully part of our RIP is housing. And then the CAC is going to have a role in the share initiative spending decisions. And so the role that we're asking you to play in this is to help Colleen from Frequent User System Entry, FUSE, to help sort of advise her on a spending plan. Next slide, please. So this is how much money there is, $57,991.63. Next slide. And this is actually a pretty quick timeline. I know September seems far away, but work like this just kind of takes a lot of time. So today, Colleen's going to show you guys a little presentation on FUSE and ask for some feedback on how you would like to see this money spent. Then in June, she'll come back with sort of a draft budget, if you will, and we'll ask you again to weigh in on that and approve it. And then Pacific Source will work with FUSE to complete documents that need to be submitted to the Oregon Health Authority, which includes a memorandum of understanding, a budget template. There'll be a application that needs to be filled in, kind of an application, I suppose, a worksheet that will need to be filled in, and we'll work with FUSE to submit that. And then once the Oregon Health Authority receives that information, they then have 30 days to approve the spending plan or come back with suggestions. Once that spending plan is approved, the money, there's 2 years then to spend that money. So with that, I'm going to ask Michaela to stop sharing, and Colleen Sinsky with FUSE is going to jump in and talk to you guys about this a little bit.
Hey, thank you so much, Kristen. And thank you so much for having me today. I really appreciate being considered for this and the work that you're all doing in the community. If it's okay, I'm going to go ahead and do a screen share. I think I have that ability, but I just emailed the PowerPoint. If not, oh, looks like I can. Let me know if you can't see that. And I'm trying an experiment where I can still see you, so I'm not doing it in full presentation mode. So I'll try to keep an eye on the chat, but if you have a hard time seeing anything, please let me know. So I'm here on behalf of Central Oregon FUSE, Frequent User System Engagement, because we believe that health and well-being start with housing. We're working on addressing chronic homelessness in our region, and I'm not able to click forward. So there we go. So I know that we're on a short time frame. I was hoping to take about 10 minutes to talk at you and request you put questions for me or comments in the chat. So I'll do my best to keep an eye on, kind of go through the problem we're working on, what permanent supportive housing is, what FUSE is doing, and what we would hope to do with the SHARE initiative. And then another 10 or 15 minutes for discussion, feedback, conversation. I know there's a lot of experts in this group, and I would love to hear your thoughts. So diving in, homelessness in Central Oregon is increasingly recognized as a problem. We know that there's approximately 1,000 or so folks who are documented experiencing homelessness. And according to the Regional Health Improvement Plan, a critical need here that kind of also defines the population we're working with. Central Oregon has a critical shortage of supportive housing units to meet the needs of people, this is our target population, with disabilities, with co-occurring mental health or substance use disorders, and those who have an extended history of homelessness. So we're working on targeting those frequent users of emergency systems, the folks who are going to the emergency room for healthcare regularly, shelters, they're having increased contact with the law enforcement and crisis services, and might be self-medicating. We're working to address our community members who are accumulating more and more barriers to health and housing stability for as long as they're outside, because we believe that housing is healthcare. It's kind of the missing piece of the puzzle in our region. We need all this, and shelters are as important as homeless prevention, which is as important as diversion. A critical missing piece here is the permanent supportive housing. I personally am involved with Fuse and so supportive because I saw such an incredible need for it, both in doing street outreach for a long time here and then being on like the data and number side with the coordinated entry system. So I ask, like, while we chat today, if you like hold someone in your mind who you've met or who you've come across with as a client or a friend or a patient who meets that definition and might be best served by this type of intervention. It's hard to get a concrete number of the need. The most concrete number we have is from the 2019 coordinated entry system, which documented about 220 individuals and households who would be best served by what we call permanent supportive housing. That number is increasing. It's up 79% over the past 2 years we have numbers for, and it's an expensive need to leave unmet. Permanent supportive housing, which I'll define in a minute, is a lot less expensive to the system as a whole than the other types of interventions that currently exist. Central Oregon is way behind where we should be. Nationally, there's about 58 units for every 100 people experiencing homelessness. Oregon as a state has about 20, and Central Oregon has just 2 for every 100 people. I'm motivated in this job because once I saw this data a few years ago, I realized like this is where my energy needs to be channeled, is in increasing our number here. So that is where Fuse comes in, through providing permanent supportive housing, because housing is foundational to health and wellness. It can be the basis for employment and education, substance use disorder recovery, safety, quality of life. Believe that housing is a human right, and it's cost effective. So it's an easy sell to a lot of different audiences. We do this by pairing supportive services with deeply affordable housing and following the housing first model, which doesn't involve preconditions to housing. You don't have to be sober, you don't have to have a job first. It assumes that housing needs to be the first step towards stability. And we're targeting folks who are chronically homeless and have a disability. This is nationally recognized as a best practice, both through being data backed. It's gotten widespread bipartisan support. We know it works. There's been peer review research for the past couple decades on this, and it's actually the most prevalent homelessness intervention in the country. It's credited with reducing chronic homelessness by 1/5 since 2007. Here's an example, because I'm very visual and it helps to have one to picture. This is something that we would hope to do in the long term. Fuse is working simultaneously on what we call scattered site, which means that we don't have this beautiful building yet, but we are working with private landlords and property managers, as well as Housing Works and Epic Property subsidized units, to get our folks into units kind of scattered throughout the community, while working towards the goal of actually operating a designated site like this one. And this, so this whole building is made up of folks whose income is low enough that they couldn't afford market rate housing. They have qualifying disabilities, and they're paying 1/3 of their income regardless of what their income is. So if they're receiving Social Security, they're paying $334 a month towards rent and utilities, while we would be channeling federal funds in through HUD to pay the other 2/3 of their rent. So I'm sure we can all imagine folks who have barriers to housing in Bend and Central Oregon as a whole. Being able to afford rent is obviously the biggest barrier for a lot of folks. Same with application fees, having the savings to pay a security deposit, or having a criminal history, mental health challenges, having a history of substance use, not having an ID or a stable phone or address, and it's intimidating, like knowing how to search for housing, like what's the first step to getting on wait lists and filling out applications if you can't drive yourself around and don't have access to the internet. We're working on bridging this gap. So our goal is to walk alongside our participants and kind of mitigate some of those barriers to housing. Kind of going through that same list, like we pay an ongoing rental subsidy provided by a grant from HUD. So our participants are paying only a third of their income. We pay for application fees, security deposit, and first month's rent. And we're advocating for tenants by supporting them with a reasonable accommodation. If they're denied for housing, we can go through and get letters of support from other care providers to kind of argue that rejection from a landlord. We're getting folks on wait lists and voucher wait lists, getting a photo ID, cell phone mailing address, and really importantly, connections to medical and mental health care. So we're partnering with Deschutes County Behavioral Health, who's like actually going out into camps to meet folks and then get people connected to Mosaic, Deschutes County Behavioral Health, get set up with a primary care provider or therapist. Our work is directed by participants, so we don't have like a one-size-fits-all case plan. We're very responsive to what our participants identify as their goals, kind of work more holistically on the measures that are going to lead to self-sufficiency at whatever level self-sufficiency makes sense for them. So what this project is hoping to do is kind of work on building the bridge from housing. So we know that Central Oregon is an incredibly tight rental market that affects the whole breadth of the income scale, but especially for folks who've been homeless for a long time, just have significant hurdles in the rental market this tight. So it's sometimes like it doesn't matter that we have this HUD funding that we can provide this secure rent for people. It's like there's still a number of barriers in a market like this. So allowing us to do a landlord engagement housing navigation will allow us to leverage existing funds that could be coming in from the federal government. Actually, just this all came together really fast. So one, I apologize for this kind of thrown together presentation. Hopefully you can't tell, but just last week, Housing and Urban Development reached out to offer Central Oregon a significant number of new housing vouchers. And there's concern among providers about whether we can realistically accept all these housing vouchers, because are we going to be able to lease up these vouchers in a market like this? We obviously would love to get more federal funding into Central Oregon to serve this population. The vouchers are specifically geared towards people who are experiencing homelessness or are survivors of domestic violence or trafficking. And all those partners are at the table. Just, you know, so this idea has come out of conversations for years. We've been talking about this across the continuum of care, but specifically yesterday we were meeting and I let folks like Epic Property Management, Housing Works, the COC and the HLC, Colleen Thomas, we were all kind of talking about this as being the biggest need. So I don't mean to imply that that was like an official letter of support from them, but that this is widely recognized as a project that would benefit not just Fuse, but the whole continuum. So what that building the bridge from housing looks like is something that other scattered site projects have done, where we're assuming that the landlord or the property manager is also a partner or a client of ours. And they're taking a risk by letting their property lease out to someone who might not have the most stellar history or might not make 2-3 times rent. So how do we make it safer for them to lease to our folks? There's a number of tools to do that exist in programs in other places and might a little bit exist here and there in different nonprofits in town, but we'd love to create this holistic package and a project that would both identify new private landlords who aren't necessarily aware of the programs that we're doing. Maybe they have a benevolent streak, or maybe they would be more incentivized by having this insurance policy and knowing that they do have rental support guaranteed at least for a year or more. But how do we both let them know about our programs and that people have guaranteed rent and supportive services coming in once a week through outreach and engagement with them, pre-screening tenants, having a support line for them to be able to reach out to in case there's any issues, and then what we call a landlord mitigation fund, which is, say we have this pot of money that exists that hopefully never gets touched, but we're able to tell landlords, by renting to our folks, you enter into a partnership with us, where if worst case scenario happens, this person reverts back to, I don't know, whatever happens, the unit gets trashed. It is something that occasionally happens when you're working with the population with high barriers. We're able to tell the landlords, like, we have this insurance for you above and beyond the security deposit amount. And that's something that in different communities has made it easier to rent to folks who might not have someone to co-sign with them on a lease.
Hey, Colleen, I need to interrupt you.
Yeah, please.
Sorry, I need to interrupt you. This is Brad facilitating the meeting. We just don't have time. I really appreciate your passion. It's clear that you're passionate about this.
This is the last slide, sorry.
But we only have so much time on our agenda, so we need to move along. Thanks.
Yeah, that was basically it. Fuse has a lot of partners and would love to hear your thoughts. So I'll defer to you about whether it's worth conversation, or I can share my email in the chat, and I apologize for going over.
It's okay. So I want to ask real quick, the next agenda item, we still have flex funds on our agenda. Are we planning on doing that, or are we going to just push that to the next? Okay. So we have a little bit of time. We still don't have much time. About a minute. Kristen, could you please just clarify? I was kind of taken by surprise by the, and maybe that's because I didn't read fully the email I received earlier, but it felt like Fuse is making a pitch to us, and I guess that is kind of what's happening here. But I'd like you to just be as transparent as you can. Like, what are you asking of the CAC here?
Well, what we're asking from the CAC is to ultimately approve the spending plan, which will be presented in June by Colleen. So this is kind of like a pitch. This is how we would like to invest this money to create more supportive housing services for our chronically homeless community members. This money also sort of allows us to accept, I think it was like 96 additional HUD vouchers to the area. But we need to make sure we have units that we can, rent to use those vouchers. And by creating this, kind of like landlord packet, and I don't remember exactly what Colleen called it, but this is something that we've heard about for years as being needed. And this funding stream that sort of all of a sudden popped up. I mean, we literally got the requirements from OHA a week ago Wednesday. So we just felt like this was a really good place to invest this money and get this project sort of off the ground and going.
And are you looking for a vote from the CAC today, or what's?
Oh, no, not necessarily today, but what we would love is for people to kind of provide feedback if this sounds like a good idea, if they have any recommendations for kind of how to go about providing more support to our chronically homeless and at-risk community members.
Okay, my guess is nobody's, I'm gonna guess everybody thinks that's a great project.
I agree. Brad, I do have one tiny suggestion or recommendation or question.
Go for it.
In Colleen's presentation, she talked about working with landlords. She didn't articulate whether there was a training program for the renters themselves or for the clients, and things like how to be a good renter, those sorts of things. I've seen it and heard of other programs that's an integral component, so they work from both sides. I wondered if that was an element of this program as well.
Sure, I can address that quickly, and Linda, I'd love to follow up if you have more specific questions, but our work with tenants directly is not necessarily a class, but it is like that one-on-one work with the case manager around those skills like budgeting and being a good neighbor and who to call when. Neighbor Impact does offer those ready to rent courses, but that at this point isn't a requirement for our program, but it's something that we're looking at. We're working with Neighbor Impact. So if you have further questions, I'm happy to answer it. That's a good component.
Thank you, Brad.
Yeah. And I apologize, we are kind of out of time. We need to move forward with the emerging issues process update. That's important for us. And clearly it looks like houselessness is it's not an emerging issue, it's an existing issue. But it's something that the CAC certainly can't solve, but might want to tackle as an emerging issue. So the next step then is what on this? Could somebody help me out? Either Kristen or Michaela or?
So next step will be that Colleen comes back in June with sort of like an outline of a budget for materials, outreach, marketing, things like that, and then asking the CAC to sort of weigh in and approve that spending plan, which will then be submitted to the Oregon Health Authority.
Okay. I'm not sure if it's just me but I'm just gonna speak my thoughts. So that feels like that's kind of encroaching on our next agenda. And I apologize for using the word encroach, but this is important. You're looking for our feedback. I'm just wondering what the best way to give that feedback is, if it's to take up that time. I'm not sure we need to be looking at Fuse's budget, but those details, that doesn't feel quite right to me. I'm not
Brad,
sure.
can I ask a question? Might do this. Is the CAC's support or review in some way a requirement for you to be able to access the money through OHA or whatever its source is, Kristen?
That we did decide that the CAC's role in this project would be to approve the budget and spending plan and be able to provide feedback on that process. So yes, it would sort of hinder that. I don't think it has to take a ton of time. And then the plan would be for Colleen to come back and say, a year and be able to sort of give like a progress update to the CAC, how that money's been used, show the packet to everybody that's been created, and share those materials that will be put into the community.
Thanks.
So I guess I would look to Michaela. I don't have fresh in my mind what else is on tentatively on our June agenda, but do you get the sense we have time for this? I mean, to actually, we could get feedback offline and then vote if we need to vote at the next meeting, but do we have time to actually look at budget numbers? And
We should. Kristen, how much time were you thinking?
10-15 minutes max. It's not going to be like a lengthy ledger line itemized or anything like that.
okay. I suppose the only other thing running through my mind is, do we just another option, I think, correct me if I'm wrong, but would be just to give a vote of confidence to Fuse and Pacific Source to work this out and just approve it. I mean, it seems so fast tracked and it looks like a great project. I don't know what people think about that.
Brad, I think I feel really valued to be included, and as a CAC member in the OHA request, that they would take this moment to come and work with us and ask our participation and collaboration in the project. And so personally, I'm supportive of CAC working with OHA over the next month to do what we need to do to get this process through, this grant request through the process.
So having a relatively, a lengthier conversation in the June agenda. That's what you'd like to do, Linda?
At this point, I think what I heard Kristen ask is, are we willing to be a part of the process between now and next month? And so I would move that CAC say, yes, we'll be involved. And then Brad, if we need to talk with staff about how we can make sure that we're involved, but the time is kept to some minimal amount for each of the members, I would support that.
Yeah, that's really the issue. We just have such limited time. as
Right.
CAC members. Okay, Ken?
That sounded like a motion. I'll second it.
Thank you, Ken. Did we capture that motion? Okay, how do the other CAC members feel? Say yes if you approve of that motion. Or put it in the chat.
Yes.
Okay. Elizabeth, are you still there on the phone? It looks like we have several yeses in the chat. All right, let's go ahead and move forward then. Thanks, Kristen and Colleen. Colleen, where'd she go? Oh, she stepped off. All right, well, let's move to the emerging issues process updates. I think all of our CAC members know we've been working on this for a couple of months, I believe, and essentially how to address and work with emerging issues, how to identify emerging issues that we actually, how to prioritize emerging issues that the CAC should give attention to and time and effort. And we asked for, Gwen is kind of running this, just to remind you of that on the staff side. And then we reached out to CAC members asking, who would like to be a part of this, giving some time to this offline. I was one of those, I think, was it Mandy? Who's the other?
It was
folks?
Lauren
Lauren.
Studic.
Okay, Lauren. And it ended up being just me when we did finally meet. So I guess I would first ask, are there any other CAC members who'd like to participate in the offline work we're doing with this?
Please.
Please.
I'd be happy to help, Brad. This is
Okay.
Linda.
Anybody else? And I think to define what that actually means, it would be anywhere from a half an hour to an hour on a Zoom call, just working with Gwen and the rest of us who are part of that to answer questions like defining urgent and or immediate, some of the terms that would help us prioritize which emerging issues the CAC would take on.
Yeah, I'd be happy to help with that too, Brad. It's Larry.
Okay. Thanks, Larry. Anybody else? Okay.
Regina, I saw your question in the chat about what days will these meetings be held. We've been doing a survey scheduling, so it's scheduled at your all's convenience when most folks can meet.
Okay, I can maybe sit in on the meetings too.
Sweet.
Great. Fantastic. Thanks, Regina.
The more the brains, the better. As great as Brad is.
No. All right. So thank you, those of you who are willing to do that with us. Is there anything else you wanted to cover in this time on the agenda, Gwen?
No, that's it.
Just kind of moving us forward, getting more participation. Okay, perfect. All right. Well, let's go ahead and talk about CAC recruitment.
So another great opportunity. So as you all know, as we've gone through our recruitment conversations, our REAL-D and demographic conversations, our part of our role as the CAC is to reflect our broad community, our 3-4+ and tribal region, so we can hear folks' needs and help address them. So one of the things that we're not quite meeting that need to reflect our communities. And so we've had a lot of conversations around recruitment with you folks, and we've met with a consultant, Renee, who is on this call as well. And some of the great ideas that you all had in conversations with her and she shared with us was really inviting some of you to help with that recruitment and help develop what that might look like, partner with creating materials and starting conversations, and who to talk to and things like that. It could be whatever it is, because you all are the experts on your communities and the people you know that may be interested and want to help with the work that the CAC is doing. So our question, what this would look like potentially is initially probably meeting for an hour or so at your convenience to kind of develop a plan, whatever that needs to be. For right now, the staff would be providing all that backbone coordination. And then so probably an hour or so a month for a few months until we start seeing some fruition and some increased partners and members into CAC. And then it may decrease as we kind of stabilize our numbers a little bit. So any questions about what that would look like? Just content-wise? And so the question that we have for you all is, who would be willing to help with those conversations and planning? And that may be one time, it may be, you know, continually over time, whatever it needs to be for you.
Hey, Gwen, can I just ask for a quick clarification from Renee, Marcus? Did we already receive, or are we going to be receiving her input on all the interviews she's done and some guidance as far as that committee's work?
Yes, I mean, she's compiled a lot of the interview information. Renee, I'll let you speak to the interview information itself. She has put together a plan and a lot of ideas that this group can utilize that we'll share out as well. Renee, do you want to speak to the interview content piece?
So yeah, very briefly, I don't have it in front of me, but yes, I hope that what I tried to do was to reflect both ideas for how to recruit within the demographic groups that you're hoping to round out the CAC with in order to be, you know, representative of the community, but also ways to, so that's recruitment, but there's also retention. So you know, the document that that I shared with the Health Council folks, Gwen and others, really addressed both, you know, how to make the CAC a welcoming space for folks who might not, you know, typically be in spaces like this. So those are sort of the two big buckets of area of discussion that I had with, you know, a bunch of folks around recruitment. And so they're reflected in that document. And then again, a bunch of ideas, as Gwen said, for, you know, who to go to. So the hope is, I think, that this, you know, by having sort of a mini work group that owns this for a little bit, as Gwen said, you know, for a few months, that we can put some focused attention on recruitment and retention. And then instead of being everybody's job, like it's the job of this little work group to kind of report in each month about how it's going. And I have no doubt that that the work group will have many, many other ideas, but I see the ones that that I developed in consultation with the Health Council and with the folks I talked to and interviewed, we'll sort of get the juices flowing.
Thanks, Renee. And how many CAC members did you interview?
I interviewed 3 OHP consumer member, and then I interviewed, gosh, I'm blanking right now, but at least a couple of other folks that are sort of tangentially related to the CAC project, including, and then of course the staff that are here today.
Okay, thanks. So back to your question, Gwen, is there anybody who's interested and just can't wait to work on the recruitment committee, or at least contribute? Maybe it doesn't even have to be at a committee meeting. Speak up, Gwen, if you have other ideas, but you could contribute offline through a phone conversation with Gwen, email.
Anyway, skywriting, clouds, it would be
Yeah,
great.
this is Larry again. I'm willing to help with that too.
Okay. Yeah, this is
I
an
would like
opportunity-
us to continue to think about also just trying to get more general population participation in our meetings, so they wouldn't necessarily have to be a CAC member, but community members that would attend our meetings. And maybe as COVID starts to lift, we'll have more opportunities that way. I went to the state convention 2 or 3, I don't know what it was, a couple of years ago. And I think it was Burns, the contingent from Burns said that they get 30 or 40 people a meeting. And I don't know how they did that, but I would like us to think about that, think along those lines too, of getting larger participation at our meetings.
Yeah. Yeah.
Probably a bigger challenge.
Yeah, looking at this recruiting and holding on to folks or helping people want to stay is a great opportunity for you all to help like remold what these meetings look like and how they feel. You know, there are different CACs all over the state do things really differently. So, you know, it's an open palette.
Yeah, one more chance, at least during this meeting. Anybody else interested in being a part of that? Putting together like recruitment plans and trying to help us meet our goals. Getting more representation on our community advisory committee. All right.
We'll come knocking on doors with flowers. Will you help, please?
All right, so we are just about at time. I just want to give a quick report back. I think, Michaela, you sent this out to everybody, all the CAC members, but the feedback on the survey, 2 survey questions that you were all invited to give feedback on. One was, what are your expectations of this Central Oregon Health Council Board of Directors to best support the CAC? And so there's good feedback on that, but I think I understood Michaela's going to kind of summarize it. Yeah, for us, and then we can talk about it in June. And then there's also the second question was about a social gathering of some sort, either virtual or in person, in July. So not a meeting, but a social, connecting with each other on a different level. And eight people responded to both of these. 7 people, actually all 8 said yes, but 1 of the 8 stressed that they would like it to be in person as opposed to virtual. So it looks like we might have a really good chance at doing that. We're moving forward with our gala at the Latino Community Association in July, so a CAC social should be doable. So thanks everybody. If you want to still give input, reach out to Gwen, I think Gwen or Michaela, I'm not sure which one, with your, either by responding to the survey using the link in the couple of emails that have gone out, or give them a call, send them an email to give them input on these 2 questions. And with that, we are all done. All right, good work.
Thank you, everyone.
Thanks.
Thank you.
Thank you.
Bye.
Thanks, everybody.